being a neuro-ophthalmologist, I see a lot of different types of causes of visual loss in the retina or the optic nerve or the brain. And as a VA physician, I also see similar problems at the VA. And we've been fortunate to have funding from the VA and the Department of Defense and the National Eye Institute for a number of years. And more recently, some of our focus has been on traumatic brain injury in terms of understanding the cause and whether after injury it progresses over time, and using the visual system as a way of investigating this, because the area of the brain that is taken up by the visual system is quite large, so it would stand to reason that if there was trauma affecting the neurons in the brain, it may also affect the visual pathways, which could be picked up on structural and functional tests in the visual pathway, including the eye. It's a very unique way of trying to study the problem, because in neuro-ophthalmology and in ophthalmology, we have very precise ways of measuring visual function and structure, and this can be tested over time to see if there's changes going on. There was a large amount of funding that was given to study this through a consortium in the United States called the Chronic Effects of Neurotrauma Consortium. It's called CENSI for short. That's organized out of VCU in Virginia. And we're part of this consortium that was funded to look into this. And so I'm just a part of a large group of dedicated scientists that are looking at MRI scans, both functional and structural, neurocognitive testing, psychiatric testing, all kinds of nervous system balance tests of function. And we're one of the sensory research areas looking at vision. There are other areas looking at auditory and other pain and other senses. It's a group of dedicated people all working together to try to get more information in veterans and also in athletes too. As you can imagine, there's a lot of parallels. And more recently, Dr. Ann McKee from Boston University and her colleagues has shown, she's a neuropathologist at the Boston VA who leads the brain bank there. And I'm sure you've seen on the news, there's a lot of new information on the entity called chronic traumatic encephalopathy, or CTE, which shows a very unique pathologic signature in the brains of athletes and veterans. And so one of the big questions is this a progressive neurodegeneration that continues to occur after injury? Or is it just an accumulation of different amounts of injury over time, but once the head impact injury stops, is there still a progressive degeneration? And if you look at some of the medical history of some of the people who've dedicated their organs to science and whose brains have been studied, you find out that even after they retired from professional sports, or veterans after they were finished with their exposure, there's a history of progressive problems that occurred after that. So there's a concern that there may be some events set into place that start to get the ball rolling, so to speak, that would cause worsening over time. And it's important, obviously, to identify people that this is happening to early and to develop neuroprotective agents or other agents to mitigate this, to stop this. So there's a lot of research looking for biomarkers to detect in the living person if this is happening. Obviously, the diagnosis now of CTE is only made at autopsy, and so it's very important to try to find some functional or structural signature that you could detect in a living person early on. Pathologic changes are the accumulation of tau protein in the crevices or the bottom of the sulci, where external forces are concentrated based on engineering principles, and also in perivascular areas. And according to her, there's no other neurodegeneration, Alzheimer's, progressive supranuclear palsy, any neurodegeneration you look at, whether it's rare or not, no one shows that type of spatial distribution of tau protein. And if you take veterans who've had TBI, who've donated their brains, and you take athletes who've had significant, repeated head injury, neuropathologically, you cannot differentiate those two cohorts of people. So it seems like a force is a force, whether it's from a blast injury or an impact to the head, is still transmitted in a similar way to the brain to cause these specific neuropathologic localized accumulations of tau protein. And over a range, some are mild and some are more severe. And this is not just characteristic of older people, because she has some specimens from people in their 20s that are showing this. So that's what's very much concern to everyone.